Rheumatoid arthritis. What is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease, inflammatory disease. Rheumatoid arthritis mainly attacks the joints, usually main joints at once. Rheumatoid arthritis mainly affects joints in the hands, wrists, and knees. Some signs and symptoms of rheumatoid arthritis: pain or aching in more than one joint, stiffness in more than one joint, tenderness and swelling in more than one joint, and the same symptoms on both sides of the body, weight loss, fever, fatigue, or tiredness, and weakness. Characteristics that increase rheumatoid arthritis: age. Rheumatoid arthritis can begin at any age, but is more likely to increase with age. The onset of rheumatoid arthritis is highest among adults in their 60s. Sex, 2 to 3 times higher in women than man. Genetics/inherited traits. People who are born with human leukocyte antigen class genotypes can also make your arthritis worse. The higher risk is worse with environmental factors such as smoking or obesity. Smoking cigarettes increases of developing rheumatoid arthritis and can make the disease worse. History of live births. Women who have never given birth may be at a greater risk. Obesity. The more a person is overweight, the higher the risk of developing rheumatoid arthritis. Characteristics that can decrease the risk. Breastfeeding. Women who have breastfed their infants have a decreased risk of developing rheumatoid arthritis. How is rheumatoid arthritis diagnosed? Conducting a physical assessment, examination, X-ray, and a lab test. Lab tests. Blood tests can be useful to make a diagnosis of rheumatoid arthritis. Blood tests will show the presence of the antibody called rheumatoid factor. However, absence of the antibody does not exclude rheumatoid arthritis. X-rays in early rheumatoid arthritis can be normal, as the involvement would limit to the synovium. Over a long period of time, X-rays will reveal destruction of joint margins, deformity, bone loss, and severe osteoporosis. How is rheumatoid arthritis treated? Treatment for rheumatoid arthritis usually includes the use of medications which slow disease and prevent joint deformity, called disease-modifying anti-rheumatic drugs, or DMARDs. Biological response modifiers are medications that are an effective second-line treatment. On the right-hand side are some types of medications: NSAIDs, corticosteroids, synthetic DMARDs, biologic DMARDs, and combination therapy. Rheumatoid arthritis comorbidities or some complications: stroke, eye problems, lung problems, diabetes, sleep issues, depression and anxiety, heart disease, vasculitis, blood disease, and osteoporosis. How to manage and improve quality of life. Get physical active. Adults should be active 150 minutes per week, such as walking, biking, swimming for 30 minutes a day for 5 days a week. Go to effective physical activity programs. Programs can help reduce pain and disability related to rheumatoid arthritis and improve mood and the ability to move. Classes can be held at local gyms, parks, and community centers. Join a self-management education class to help control symptoms. Stop smoking and maintain a healthy weight. The end. This is the end of my lecture.